Let's take you to KZN now, where the true cost of the devastating floods that happened in April are still being counted. Several parts of that province still find themselves without water 2 months after the deluge. Healthcare facilities and hospitals have been hit hard as their taps have been running dry, forcing nurses to bathe patients with water-boiled sources from nearby water tanks. eNCA reporter Letu Mhluli is following these developments, and we cross live to her just to paint us a picture. Letu, good afternoon to you, or good morning rather. Tell me exactly what kind of stories have nurses and patients been telling you from those hospitals that still have no water and electricity?
Well, Maseko, a few months ago we were actually here outside Prince Mshiyeni Hospital, where we were investigating some of the things that the staff were reporting about not having running water inside the hospital. We spoke to a few patients who shared with us that they had to move outside their ward and fetch water from JoJo tanks that were provided by the Department of Health in the province. And that is, of course, because majority of the infrastructure that supplied this hospital with water was damaged. The pipe that supplies the hospital with water was damaged during the April floods. It's not only this hospital that was affected. Of course, some other hospitals were also on the list, including Albert Luthuli Hospital and Mahatma Gandhi Hospital. These hospitals that I'm naming are one of the biggest ones that we have in eThekwini. And not so long ago, we actually covered a story in Escourt in the northern part of the province, where the nurses there told of stories where they had to use a kettle to warm water so that they can give their patients a warm bath. And that's because the infrastructure in that part of the city as well was damaged. And we do understand it's not because of the floods, but it's just the aging infrastructure. It forced the hospital to then have some JoJo tanks so that the water can have so that the hospital rather can have water. But right now I'm actually joined by Nehau. I want to speak to them regarding the conditions that the staff is currently facing when it comes to the water issues around the province. I'm now joined by Prince Mtalane, who is the regional secretary for Nehau. Prince, thank you so much for joining us at eNCA. Take us through what the staff, especially around these hospitals that have been affected by the water issue, have been telling you as a union.
Thanks. Greetings to you and greetings to the viewers at home. Yes, we have been receiving reports about the dire situation that the institution has been facing following the floods that took place, which damaged most of the infrastructure and which also affected the supply of water in this hospital. According to the report that we have currently, is that the situation has improved. But what is of the problem now is that because of the leakages that are there, because of the aging infrastructure, so from time to time there are water cuts when the institution has to attend to those leakages that are there in the infrastructure. So that is a problem that we are currently facing. But initially it was a huge problem because nurses were made to fetch water. You will understand that in a health facility, if the issue of water is a problem, then there's also an issue of infection that is compromised at the same time.
Right now, you just spoke about the issue being improved. We actually did go inside the hospital and see for ourselves, just to check whether they do have running water, and we had a chance to speak to the government. What do you think the government needs to do to improve situations, especially in Escourt?
The general problem with the Department of Health is the issue of the dilapidated infrastructure, which we've been raising for quite a long time, to say that some of these facilities, their infrastructure is no longer even in the condition where they can be able to serve the community. But of course, all those calls have been falling on deaf ears because that is further exposed by the recent floods, because now it's taking too long for them to be fixed on the basis that they are old infrastructure and the department has not had any plan to modernize and renew the infrastructure in these facilities. That is why we are having this problem now, which is going to continue because There's also an issue of the austerity agenda that is being driven by the Treasury, so which is cutting budget, is going to further exacerbate the problem. So which will reside then in some of these facilities not being able to service the community, which they're supposed to. So as a union, we'll continue to engage the government to say it does not make sense for the government to cut a budget on a strategic department like Department of Health, where the infrastructure needs to be replaced, because remember, some of these hospitals were built in the 80s and all of that. So there have not been any serious maintenance plan that has been taking place. That is why now we are finding ourselves in this situation where a small damage, which is supposed to take even maybe a few days to fix, it takes more than a month, because now we are dealing with an old infrastructure.
Thank you so much.
Thank you.
So, Masego, that is Prince Ntalane, who is the regional secretary for NEHAWU, just basically taking us through some of the issues that the staff has been dealing with since the floods. He's also made a very important point where he's talking about the aging infrastructure in these hospitals. The Escort Hospital was the one that was actually having to fetch water, where the staff had to go and fetch water in Jojo tanks outside, and that's because of the aging infrastructure in that region. We will be speaking to the Department of Health to get a response and also an update on how long this issue is going to take, and what plans they have in place to fix the water issues in these hospitals.
All right, Lethu Mdluli and Durban, let's leave it there for now. I'll be back with you at